So what is a pelvic floor PT? Well, a pelvic floor PT is a physical therapist, and a physical therapist is a musculoskeletal and neuromuscular expert in their field. So during our training, when we're getting our graduate degree, we get extensive training from the early development, even in utero, all the way up the lifespan until elderly. So we have tons of education regarding the true musculoskeletal system and what's going on. As far as a pelvic floor PT, we have expert knowledge on everything in the pelvic floor. But what's cool about most of the pelvic floor therapists, and I hope that I'm treating this way as well, is that we look at the whole body as a picture. It's not just the muscles underneath the pelvic floor. They are connected and they are surrounded by the hip and the glute musculature, which is also connected up the chain all the way up and down the chain. So usually if a pelvic floor has a dysfunction, there's also some other component that's going along with it. So when you go to a pelvic floor PT, some people are Googling it, and there are some misconceptions about what to expect during a pelvic floor evaluation. So I wanted to come on and give you what I typically do during a first visit or an evaluation for my patients. Ideally, I've conversated with them. Ideally, they've sent me some history. Otherwise, I'm going to spend quite a bit of time of their history. I'm going to go over anything that they've been through in their life, hopefully regarding pregnancies, deliveries, if they've never had a baby. Depending on what they're in there for, I'm going to be looking at a long time before, and then if they remember any onset of injury. Sometimes there's no injury, sometimes there's a significant event that occurs. After going through your history, I'm going to look at your body in standing. I'm going to assess the way you're standing. You may not know I'm doing it at the time, but I am. I actually start when you walk in the door. I'm watching the way you move. If you're sitting down, I watch the way you get up. I watch the way you walk into my room and then sit in whichever chair is most comfortable for you. From there, I will do my assessment. I'm actually watching your whole body the whole time. I'm watching if you're uncomfortable, you're readjusting, you're moving, and all the things that might be involved with some discomfort or pain. Then I will actually start with you standing and then sitting. I'll have you sit on the table. I'll come behind you. I'm looking at your posture. I'm looking at the way that you're moving. And I will look all the way down, the whole spine. I'm seeing if there's dysfunction on one side compared to the other, if one side doesn't look the same as the other. I won't go into the nitty-gritty details, but I'm going into depth about one side versus the other, and then I'm taking into reference where your pain is at. From there, I'll lay you down and I'm assessing the muscles. I'm assessing the bones. Where are the bones in relation to the muscles? Can you squeeze a muscle? Can you lift a muscle? Can you squeeze and lift a muscle? Are they coordinated? That's a key component that you're going to learn hopefully in the next few videos, that the coordination is key. If there's no coordination in a muscle, for any muscle, then you're going to have some sort of dysfunction or a compensating pattern. So I want to look at everything the way you're moving. Then I'll flip you over to your belly and I'm looking at the hips, and it depends on what you're coming in there for. If you're not coming in for your low back or hips, you're just coming in for hormones, I might not, but at the same time, I also want to get an idea of what's happening with your body and how it's moving. From there, I will do my assessment, and then I will do some manual therapy. I'm a very hands-on manual therapist, and so I don't just say, hey, you have this, this, and this wrong. I need you to come back and follow up with me. No, I'm going to spend as much time as I have to be able to get through what we can. Are the bones moving? If they aren't, I try to help them move. Are the muscles moving? If they aren't, we need to try to co-contract them and figure out how to get brain and muscle activated. Then if we have time and if it's absolutely appropriate, that's when the internal evaluation is talked about. Sometimes patients are totally on board, they're ready to go, they want to find all their issues. Usually those people have already talked to me in the past, they've looked up pelvic floor PET and they expect it, but a lot of my patients don't expect it. So I definitely try to do it if I feel like it's absolutely necessary. I'm going to tell you that it's absolutely necessary and would be beneficial for us. But there are so many other things that we can work on that it's really not the end of the world if we don't do it on the first visit. We may not even do it for a couple visits. So the internal evaluation is what everybody's terrified of. And it actually has nothing to do with an OB-GYN exam. There's no stirrups, there's no speculums, there's nothing crazy. So I'm going to post in another video on what the pelvic floor is, what the muscles are, what they do, and then I'm going to have a video about what a pelvic floor evaluation is, what it entails, and what to expect whenever you do have to have an internal evaluation from my perspective. All pelvic PTs are different. We have training from different areas, but even if we have the same training, we all have different experiences and we all have different patient populations. So try to hone in and find what works for you.